Hello, my name is Jennifer. I'm a nurse practitioner student, and I'm going to be examining you today, if that's okay.
Yeah.
Can you tell me your name and birthday?
Jeffrey Moles, 12/16/85,
Thank you. Do you know where we're at right now?
from my house.
Do you know what month and year it is?
March 4th, 2024.
All right, thank you. Upon entrance into the room, patient is sitting upright with good posture, well hydrated, well nourished, good hygiene. He is has no respiratory distress, no retractions, no nasal flaring, no pursed lip breathing, alert and oriented times three. Head is midline, upright, no obvious deformities or lesions, noted normocephalic. Neck is midline, symmetrical, trachea is midline. I'm going to just check for your thyroid gland. Can you swallow? Thank you. Thyroid gland is not palpable. I am going to check your lymph nodes right now. There is pre-auricle and post-auricle and occipital, submental, submandibular, um, superficial, deep posterior cervical, and supraclavicular. Was that tender at all?
No.
Lymph nodes are non-palpable and non-tender. I'm going to check for carotid bruise right now. And we use the bell for that. Can you turn that way and then take a deep breath and hold it? All right, you can let go and then turn towards me. Take a deep breath and hold it. All right, you're good. No carotid bruise noted. Facial features are symmetrical. I'm going to turn the light off for a minute so I can check your eyes. So just look straight ahead. Pupils are equal, round, reactive to light and accommodation. All right, you can look straight ahead. I'm going to kind of just look inside your eyes now. All right, I'm going to kind of look at your other one. Red reflex is intact. Fundoscopic exam, the lens is clear. Normal vasculature, the retinal color is orange yellow without lesions. No narrowing of the vessels or retinal hemorrhage noted. The optic disc margin is sharp with well-defined edges. I'm going to turn the light back on. All right, I want you to just let me know when you can see my fingers, okay?
Yeah.
All right, thank you. I want you to look straight ahead and follow my finger with just your eyes. All right, peripheral vision is intact. Extraocular movements are present without any nystagmus noted. I'm going to just kind of look in your nose now. The nares are patent bilaterally. I'm going to check your sinuses now. Frontal and maxillary. Does that hurt at all? Frontal and maxillary sinuses are non-tender to palpation. I'm going to look at your ears now. Does that hurt at all? Tender at all? Ears are symmetrical. Tragus, auricle, and lobe are movable, non-tender with no masses noted. Just gonna kind of look in your ears now. I'm gonna look at your other ear. The external auditory ear canal is pink, clean without excessive Serum or drainage noted. The tympanic membrane is transparent and pearly gray with visible landmarks. The cone of light is present in the left ear at the 7 o'clock position and at the 5 o'clock position in the right ear. No perforation or bulging noted of the tympanic membrane. No fluid behind the tympanic membrane. No foreign bodies, erythema. Do your ears hurt you at all? Or pain noted. I'm going to take a look at your mouth now. Just open it around, stick your tongue out, say ah. All right. Mucous membranes, lips are pink and moist without any ulcerations or lesions. Teeth are in good repair with no decay or odor noted. Uvula is midline. The soft palate rises with phonation. No tonsils present. No postnasal drip present. Tongue is fits the mouth appropriately without any protruding or tremors noted. All right, I'm going to check the cranial nerves now. Cranial nerve 1 is olfactory, which is smell. So I'm gonna have you plug one nostril and smell this. I'm gonna have you plug the other nostril and smell it. Right. And what does that smell like?
Lavender.
Olfactory nerve is intact. Cranial nerve 2 is the optic nerve, which is visual acuity, visual fields in the fundoscopic exam. The fundoscopic exam was normal, so I just want you to read the lowest line that you can read.
LTFPH.
All right, vision is 20/20. Cranial nerves 3, 4, and 6 are the ocular motor, trochlear and abducens, which is extraocular movements, cardinal fields, eye movements, perla, and eyelid droop. There's no eyelid droop noted. Extraocular movements were already checked and they were present without any nystagmus noted. Perla was good. Eye movements are normal. Cranial nerve 5 is trigeminal. I'm going to have you clench your teeth for me. All right. Can you feel this on both sides?
Mm-hmm.
Does it feel even?
Yeah.
Good jaw strength and facial sensations. Cranial nerve 7 is facial. I want you to smile for me and raise your eyebrows, wrinkle your forehead, close your eyes and puff your cheeks out. Trigeminal nerve is intact. Facial nerve is intact. Next is the 8th cranial nerve, which is acoustic. I'm just going to check for hearing. All right, can you hear that equally in both ears?
Yes.
All right, and then I'm just going to cover this ear and whisper a couple things into this ear, okay?
46. 72. 14.
All right, and the same thing on this side.
62. 12. 98.
All right, hearing is intact on both sides bilaterally, or both sides, symmetrically. Cranial nerve 9 and 10 is glossopharyngeal and vagus, which is the gag reflex and swallowing. And then is there any problem with like your swallowing at all?
No.
All right, I'm gonna have you stick your tongue out for me. Gag reflex is present. Cranial nerve 11 is spinal tester. I'm gonna have you shrug your shoulders up. All right, I'll have you turn your head against my hand. All right, and then this side. Spinal accessory is intact, good. Shrugging the shoulders, turning head from side to side. And the 12th cranial nerve is hypoglossal. I want you to stick your tongue out, like move it side to side, up and down. All right, cranial nerve 12 is intact. Next is integumentary. Skin is pink, clean, good skin turgor noted. All right, and then there is a small, no obvious lesions or anything. There's a small macule on the right forearm here that is symmetric, even borders, a light brown color throughout, less than a 1/4 inch in diameter. Has it changed at all? With no evolution or elevation noted. Right. I just want you to kind of breathe or normally for me. I'm just gonna kind of feel a little bit. Did that hurt at all? Chest wall is non-tender, no masses felt, no lifts, thrills, or heaves, no crepitus. Um, the apical impulse or location is the fifth intercostal space midclavicular line. I'm going to listen to your heart now. We listen to the heart with the bell and the diaphragm in all five locations. So just breathe normally. Um, Atrial is the second intercostal space, right sternal border. And then next is pulmonic, is the second intercostal space, left sternal border. Erb's point is the third intercostal space, left sternal border.
Hmm? Hmm.
Tricuspid is the fourth intercostal space, left sternal border. And mitral is the fifth intercostal space, midclavicular line. Okay, heart sounds were regular, rate, and rhythm. Crisp S1 and S2 heard. No S3 or S4 were heard. No murmurs, splits, or gallops were heard either. I'm going to listen to your lungs now. Can you sit, just kind of sit forward a little bit and then just take some deep breaths in and out for me.
Hmm.
Listen to the front now. Just keep taking some deep breaths. Lung sounds are clear throughout, no adventitious sounds such as wheezes, rails, or crackles noted. Lung expansion is Good lung expansion is noted. Respiration's even and unlabored. All right, I'm just gonna kind of check your kidneys, okay? See if they're bothering you at all. That hurt at all?
No.
That hurt at all?
Mm.
Nose, CVA tenderness noted bilaterally. I'm going to check your pulses now. The carotid, we do not check at the same time. All right, and then radial, brachial, femoral, just sit back a little bit, or kind of like just under the pants line right here. And then put your legs out for me, please. Popliteal behind the knee, dorsalis, pedis on the foot, and then posterior tibial. All right. Pulses are present, regular, 2+, symmetric, easily palpable. Carotid pulses were present. No jugular vein distension noted. I'm just going to kind of take a look at your legs a little bit. No edema noted, no varicose veins noted on the legs. All right, I'm going to sit you back a little bit, okay?
Yeah.
All right. I'm going to listen to your abdomen now. We listen before we touch it at all. I'm going to listen to all 4 quadrants. Right lower, right upper, left upper, left lower. And then I'm also going to check for some bruits here. There's your aortic, iliac, renal, and then femoral again down here, kind of right under the pants line. All right, I'm just going to feel around a little bit, okay?
Yeah.
Start with some light palpation all the way around. Not hurting at all. And we're going to go a little bit deeper. Not bothering you at all? All right, I'm going to kind of just check your liver here. Okay, deep breath in. All right. You can breathe out. I'm going to check your spleen over here. Deep breath in. All right, thank you. I'll sit you back up now. Bowel sounds were normal active in all 4 quadrants. No lesions, masses, hernias are noted to the abdomen. No bruits are noted. The abdomen is soft, non-distended. No masses palpated. No tenderness with light or deep palpation. No liver or spleen enlargement. All right, can you squeeze my fingers for me? All right, good. You try to push your arms up against as I'm pushing them down. All right, same thing. Go down and then go up. You push your arms out. You kind of push them in. All right, your legs. I want you to kind of just push your legs up against me. All right, and then down. All right, push your push your toes forward like you're pushing the gas pedal, and then bring them back. All right. 5 out of 5. Strength in the upper and lower extremities, symmetrical hand grasps, symmetrical strength throughout. No varicose veins or edema noted. I'm going to check your deep tendon reflexes now. All right, so just kind of relax your arm. Brachioradialis. And then here, just keep it relaxed. Let me kind of like hold it. And then this way, just that was the biceps. This is the triceps. Same thing over here. Brachioradialis. Biceps. And then kind of bend it, keep it relaxed. Triceps. Here we're going to do the patella. Relax your leg. All right, and then we have the Achilles back here. On this leg. Relax it though. Let me just hold it. Deep tendon reflexes present. Symmetrical bilaterally, 2 out of 4 normal. I'm gonna check your feet or check your feet now. All right. Just kind of looking good. Circulation to the feet. Good capillary refill. No deformities or ulcers. Ulcerations or open areas or noted. Good skin integrity is intact. Can you feel this as I'm touching throughout? Patient has good sensations to light touch throughout on the feet. All right, I'm going to have you stand up for me and just kind of walk to the desk and back. All right, you can stay standing. Okay, I want you to stand with your feet together, your arms at your side, eyes closed. All right, thank you. You can sit back down. Gait was normal, no limping or swaying noted. Patient had negative rhomboid. And that is the end of our examination. Thank you.